Patient came in with pain in the left side of the lower neck and left upper back. That's been happening for about 2.5 weeks. Started out as just a stiff neck, woke up with that, started to turn into more pain in the neck, then started to have more pain in the upper left shoulder and back. That turned into radiating pain down into the shoulder, as well as numbness and tingling down the arm and into the thumb and forefinger. Typically that's a C6 nerve root distribution. As it turns out, that's where his major problem was, is C5, 6, lower cervical spine, and 7. But what was also associated was the posterior ribs on that same side, restricted posteriorly out of their normal plane of motion, creating inflammation, muscle tension, which is affecting this whole circuit up through here, compressing the nerves as they were going down through the upper limb. Patient should respond very well. He's a healthy guy. It's only started about 2.5 weeks ago. But what we looked at with the exam with him is that he had a head-on collision in 2010 that probably predisposed him to some of these things, created some issues that have been slowly building for the past year or so that, unbeknownst to him, that were occurring. As you can see here, here are the posterior ribs that are associated with his problem. Here is the C5, 6 left cervical area that's also rotated posteriorly and restricted in a posterior plane of motion, as well as the posterior ribs here. Then the muscles through here, the trapezius, rhomboids, levator scap, as well as the paraspinal muscles of the cervical spine are adding to his entire issue, compressing the nerves as they go down through the upper extremity, all the way down into the hand. Patients should respond in about a week to 2 to 3 weeks. This is so acute, and should do very well.